Hey folks, I'm attorney Ben Schwartz. Today we're going to do a special video with my special guest, Dr. Douglas Chervenak. I also have my law clerk, Chip Welch, in the room with us, and Chip's going to help us out. Today we're going to talk about the DRX 9000 machine, which Dr. Chervenak has in his office. He's the only doctor that I know of in the state of Delaware, at least that I know of. There might be other doctors in the state of Delaware that have a DRX 9000, but he's the only one I know of who's got this machine, and it's something special, and so I figured we would shoot a quick video and have him talk about the machine and what it does. So Doc, can you talk for a moment about what is a DRX 9000 machine?
It's a very interesting machine. The principle of the DRX 9000 is to put traction in the right place. This is a spinal column, and these are the discs in the spinal column. And the DRX, if it's L5 and L4 disc, like it is here, then we put the traction right there and expand the disc. It used to be known that, or thought that the disc didn't expand, but it does. And people that go up in the space station, they're finding are actually growing in size because these discs, all of them enlarge.
I want to ask you a question unrelated to the machine, but on this note of discs expanding, enlarging, I was told that I was 6'1", and then I'm almost 50 years old. I got measured again, and it turns out I'm not 6'1" anymore, and I was told that my spinal column is shrinking with age. Is that related to what we're talking about here?
Yes. They lose hydration. They lose probably hydration because when a person goes up in the space station, they rehydrate. They're identical twin astronauts. The one was spent 300 days. He's the brother of Mark Kelly, the senator from Arizona. He gained 2 inches over his brother.
Wow.
In 300 days.
From not having the downward pressure.
That's correct.
On the discs in the
gravity.
spine.
Gravity's a problem.
Yeah, gravity can be a problem.
Yes,
for
it
some
can.
of us.
Yes. So this is what it does, and this is I show you the difference. This does is that this is a treatment. It basically ramps up to max and ramps down to half max. Ramps up. Now, in the ramping up process, it stops when you jerk the muscles of the back. There can be a reflex contraction. So this eliminates that contraction. It goes through 18 cycles. Here's the number of cycles, and this is measured load. This is an amazing machine in that it measures. You set the poundage, and it gets it right to the pound, as far as the strength of the traction.
But what it does is, when you're on the machine, it's pulling open your spine.
It's pulling, and we target. See, for example, if it's L4, L5, we'll push 4 on one treatment, and you see this goes up and down, and then the next treatment we'll push 5 to get the differences in the L4 and L5 vertebrae.
So opening up the spine and opening up those disc spaces, what kind of diagnoses or what kind of conditions does that treat?
Well, again, let me get back to the spine. If you notice, the nerves come out next to the spine, and these are discs. These are called facet joints. If with aging you can get narrowing of the disc, and you get arthritis changes and that sort of thing, and get compression on the nerve. And the front part of the nerve is the sensory part, and the back part of the nerve is the motor part. So if you get, most of the people get pain that run down their leg, and that's called sciatica. But if you get weakness, then that means that the nerve is compressed to the point that it's affecting the motor part of the nerve. Most of the time we're looking at people who, the aging process, but sometimes falls will cause it. We're treating a lady now who fell, but she hurt herself. Auto accidents can do it. Old football injuries, the high school heroes that
Yes.
sort of thing, that now they're in their 40s and 50s.
And the Weekend Warriors.
And the Weekend Warriors, yes.
I might know one or two of them.
Yeah. At any rate, that's what we do, and we have an 80% success rate, which is kind of amazing when you think about it. The other reason I got this machine, we have a 15-year history, is because it doesn't make people worse. It may not make them better, but it doesn't make them worse. And in the 15 years, we've had maybe 5 people that can't tolerate the treatment. So it's been very good at both for the neck and the back. And I hate to tell the surgeons this, but I've kept a number of people out of the surgical suite because of the effectiveness of this treatment.
Very good. Do you think we could test it out? Maybe we can put Chip in there and
Okay, yes we
give him
can.
a little traction?
Yes. Okay, you wanna shut it off for now? Here we are, this is Chip. And he is on the table, and if you notice, here's the traction around his hip. We immobilize the upper body with a strap here, and this is for the armpits. So, and then we start the program, okay, by running it. You see it?
So what this is gonna do, if I'm correct, is it's gonna pull,
Pull.
this pulls this way and the bed moves that
And you
way.
see here, this is the traction going up.
Oh, I see, the traction is going up. How do you feel, Chip?
I feel like I'm about to slip off here.
Yeah? Do you feel
You
like
won't.
it's pulling open your spine, your low back?
In a good way.
Good.
And as soon as we get
When this says measured load 74.9 pounds, is that the amount of pressure that it's pulling?
yes, it's up to 85 pounds.
Oh, very good.
I don't feel it pulling up here.
You put your head down, relax.
Yeah, just
And then-
relax, Chip. We're gonna stretch you out.
And then Alexa, play nice music.
Here's a playlist you might like. Solo classical piano on Amazon Music.
That's great.
Six, seven, one. Alexa, stop. 671. South Carter Road in Smyrna. Our phone number is 302-653-1050. The consultation for anybody with back pain is initially free and at no charge. But please bring your MRI. Otherwise, I'm going to order an MRI. Hopefully, they'll pay for it. But that absolutely distinguishes what disc we're going to treat.
Sure, absolutely. And this is something where you can target the specific disc.
Correct.
And the way it does it is by
The angle.
changing the angle of the traction.
Correct.
Well, that's fascinating. Well, thanks very much, Doc. I appreciate you taking time to do a video
My
and
pleasure.
give us a demonstration. Folks, if you have questions about this, I can always pass questions along to Dr. Chervenak. If you have questions in general about the practice of law or personal injury litigation, something you think would make for an interesting video, send me an email. My email address is ben.schwartz@schwartzandschwartz.com. Thanks for watching.